Hi, this is Sarah McClellan with Pixels and Pills, and we're at BDI's Mobile Healthcare Communications Roundtable and Case Studies here in New York City. I'm standing here with Mr. Amir Kishon from Wellness Layers. Can you tell us a little bit about your background and about the company?
Sure. Well, let's start first with the company. We basically, I think if you look today, everything is a little bit disjointed. You have a little bit of mobile, a little bit of website, social. So what we basically do is we help other companies in healthcare and wellness basically build their online mobile and health consolidated environments. Very much like, as you will expect today from banking and online banking, we help healthcare and wellness companies do online health and online wellness. So that's what we do. My background, I'm kind of been in the crossroads of health and internet since 1995, actually. So this was, I always joke that this is before Mark Zuckerberg has been born, but that's previously from a company called Softwatch that helped pharmaceutical companies, and today helped the general health and wellness markets.
So it seems to be, a huge push in discussion about how important it is to really connect to the consumers and connect to the patients and the e-patients through mobile marketing, through the web, through all of these platforms. Do you find that it's just growing and becoming more and more important each day?
Well, I think that it is definitely growing. You don't need myself to kind of point to the data that shows that. But I think what really makes things different is if you look historically, and I have this kind of historical vantage point, is that historically sites were mostly information sites. But now there are different components that make things much more engaging. First, let's start what we call the me layer. Wellness layer. So we have different layers of engagement. The me layer is everything that relates to self-management and also pairing yourself with your healthcare professional to manage your condition. We can do that, and we can do that with laptops, but we can now do that with the mobile phones and making things accessible and feasible. So this is the me revolution, if I may say so. There is also a we revolution, all the social aspects. And if you look at patients, usually we talk with themselves. They compare notes. You've done that procedure, you should consider that. So this whole idea of the we layer, integrating that. Now, once you mesh the me and the we into an info, the info side that was there before, what you get is a very powerful component, and we call that our formula, which is the me plus we plus info squared, that drives a significant engagement. Now, the squared is connecting everything together. As I said, we are not just doing communities for companies, or we are not just building personal management. We are trying to create a consolidated experiences for our clients.
So this is linking everything together: Twitter, Facebook, website, information, Google links, everything? Well,
we are very big proponents of private destinations.
Okay.
Do you communicate with your bank through Twitter or through Facebook? No. You have a bank destination where you talk with either your bank staff, or you do your self-management. Or so we are proponent of that. Obviously, Facebook and Twitter are drivers and are there, and you need to connect with them. But I think that as a patient, I would like to connect with my hospital.
Right.
And I don't want basically to talk with my hospital and basically expect that this will be public. That's why, by the way, I'll give you stunning statistics. We're working with Nutrisystem, which is a large diet company.
Yes.
Their Facebook page is about 10,000 followers. Their private community is over 3 million.
Oh, wow.
So it's kind of a totally different dimension. So you need to create those kind of private destinations.
So you're also adding sort of like a community support network in those private websites. Is that what you're trying to do as well, to connect those consumers and patients to other people just like them, managing their, whether it's weight loss or whether it's their illness or their diseases? You're trying to integrate that as well without making it so public.
This is key. People want the private communities, and especially they want the private community and talking with other experts and other people that are in their region. So, for example, we're working with hospital systems. So, for them, locality is very important. You don't want to talk with someone if you're in Philadelphia, someone in California, but you want to exchange notes with someone that is local to you about your hospital environment, the local environment with hospitals and so on. So, locality. Socialing, the social aspect, it's not social, it's not get to be friends, but it's exchanging tips and information, and we all do that. So we provide those we info platforms and connect them in a meaningful way, so you get this kind of, you get value at the end. It's not just kind of, okay, I get a community, or here I get some kind of a nifty tool.
Well, thank you so much for speaking with us today, and good luck with your company and the rest of the conference. This is Sarah McClellan with Pixels and Pills.